Understanding Epilepsy, a neurological journey, delving deep into the complexities of the human brain. Epilepsy is a neurological disorder that affects the brain, disrupting its normal functions. It is characterized by recurrent seizures, which are episodes of abnormal electrical activity in the brain causing significant disruptions. These seizures can cause a wide range of symptoms, from brief periods of staring to prolonged convulsions, affecting daily life. Imagine the brain as a complex electrical system with intricate circuits and pathways. When epilepsy occurs, it's like a sudden surge of electricity disrupting the normal flow, causing chaos. This disruption leads to the various symptoms we see in epilepsy, making it a challenging condition to manage. Understanding epilepsy is crucial for both patients and their families, providing them with the knowledge they need. It empowers them to seek timely medical help and manage the condition effectively, improving their quality of life. The face of epilepsy prevalence and risk factors. Epilepsy affects millions of people worldwide across all ages and backgrounds. While it can develop at any age, it is more commonly diagnosed in children and older adults. Several factors can increase the risk of developing epilepsy. These include genetic predisposition, meaning it can run in families. Other risk factors include brain injuries, infections like meningitis, and abnormal brain development. Knowing the risk factors helps in early identification and intervention, potentially reducing the impact of epilepsy on an individual's life. Unraveling the causes, from genes to infections. The exact causes of epilepsy are still being researched, but several factors are known to contribute to its development. Genetic mutations can disrupt the brain's electrical activity, making individuals more susceptible to seizures. Brain injuries, such as those sustained during a traumatic accident or stroke, can also lead to epilepsy. Infections like meningitis and encephalitis can cause inflammation in the brain, increasing the risk of seizures. Understanding the underlying causes of epilepsy is crucial for developing targeted treatments and improving the lives of those affected. Section 4. John Doe's story, a case of epilepsy in Kigali. John Doe, a 30-year-old teacher from Kigali, Rwanda, experienced his first seizure while teaching his students. It was a typical day in the classroom when suddenly everything changed for him. He suddenly felt confused and lost awareness of his surroundings. His students watched in shock as he struggled to maintain his balance and eventually collapsed. When he regained consciousness, he was disoriented and had no memory of what had happened. The experience left him and his students deeply shaken. Concerned about his symptoms, John visited a local clinic where he was referred to a neurologist. He knew that something was seriously wrong and needed professional help. After a thorough medical history and physical examination, the neurologist diagnosed John with epilepsy. This diagnosis was a turning point in his life, providing clarity but also raising many questions. John's case highlights the importance of seeking prompt medical attention after experiencing any seizure-like symptoms. Early diagnosis and treatment can make a significant difference in managing the condition and improving quality of life. Section 5. Navigating epilepsy treatment and management. Managing epilepsy typically involves a multifaceted approach combining medication and lifestyle modifications. Anti-epileptic drugs, or AEDs, are frequently prescribed to regulate brain activity and reduce the frequency and severity of seizures. Lifestyle changes, such as stress management techniques and getting enough sleep, can also play a significant role in managing epilepsy. Identifying and avoiding triggers, which can vary from person to person, is also crucial. Effective management of epilepsy aims to control seizures, minimize side effects from medication, and enable individuals to live full and active lives. Section 6. Life after diagnosis. John's journey to wellness. Following his diagnosis, John started on anti-epileptic medication and made necessary lifestyle changes. He worked closely with his healthcare team to find the right balance of medication and lifestyle adjustments. He learned to manage his stress through meditation and ensured he got adequate sleep. Regular yoga sessions also became a part of his routine, helping him maintain both physical and mental well-being. He also identified and avoided potential triggers that could exacerbate his condition. This included avoiding alcohol, being mindful of his diet, and steering clear of environments with flashing lights. With proper medical care and self-management strategies, John's seizures became less frequent and less severe. He kept a detailed health journal to track his progress and consulted regularly with his neurologist. He was able to return to his passion for teaching, inspiring his students and advocating for epilepsy awareness. His journey became a source of motivation for many. John's story exemplifies how, with the right treatment and management, individuals with epilepsy can lead fulfilling lives. He now enjoys quality time with his family and actively participates in community events, spreading hope and awareness.